Hi fellows, welcome to our YouTube channel. Today we will be talking about Naegleria fowleri. Pakistan is ranked the second most affected country where most of the cases have been reported from Karachi. So today we'll be discussing about different aspects regarding to Naegleria fowleri. Naegleria fowleri belongs to the phylum Percolozoa, and Percolozoa is a group of colorless protozoa that can be found in aquatic and terrestrial environments. It belongs to the class Heterolobosea. Heterolobosea are the subgroups that comes under Percolozoa, and they are primarily found in soil, fresh waters, and occasionally in the marine waters. It belongs to the order Schizopiranida and family is Welcomfidae, genus Naegleria, and the species from which it belongs is Naegleria fowleri. So in this video we'll be talking about the transmission and different kind of preventive measures that we can do to prevent ourselves from this infection. So moving towards the introduction of it, so brain-eating amoeba, it's a rare but highly dangerous organism that can cause a severe and usually fatal brain infection, which is called as primary amoebic meningoencephalitis or PAM. It belongs to the phylum Percolozoa that we have discussed earlier, and it is technically classified as a shape-shifting amoeboflagellate excavata rather than a true amoeba. PAM is basically an invariable fatal infection of the brain. It destroys your brain tissues, causing severe brain damage, swelling, and death in the most cases. It is found in the warm freshwater environments, lakes, and in the swimming pools and hot springs as well. Then moving towards the transmission and infection, basically it enters through your nose, and a very rare infections have been reported in which the transmission occurs to the contaminated water. So it cannot enter from your intact skin or through any kind of ingestion. So the specific nasal route is required for the transmission of the amoeba into your body. Next, moving towards the PAM, what is it? So it is basically a serious infection of the human central nervous system. A number of cases have been reported in which the patients who were suffering from this infection, they were found often visiting the swimming pools and these kind of contaminated water bodies that ensured and that confirmed the presence of this amoeba in the contaminated water bodies. It enters, you can see it enters through the nasal route, and from the nasal route it enters into the olfactory nerves, and from the olfactory nerves it enters into the cribriform plate, which is present at the base of your skull, and from there it enters into the olfactory bulbs. Olfactory bulbs are basically the several types of nerves that are present in your brain and that controls the sensation of the smell, and they basically cause infection in these olfactory bulbs. There are two olfactory bulbs that are present in your brain. One is present above each nostril, and the infection it causes inflammation in these in olfactory bulbs, which leads and in 97% of the cases it leads to the death of the patient. So PAM is basically a fatal infection that in most cases would result in death of the patient. Moving towards the symptoms. The symptoms includes the initial symptoms and the later symptoms that we will discuss in detail. The initial symptoms include headache, fever, vomiting, and the later symptoms include stiff neck, seizures, etc., and lack of attention, as we know that it affects the brain. Prevention and treatment. Prevention of any disease is very, very important. Public awareness, it plays a very important role to prevent ourselves from any kind of disease or any kind of infection. In case of PAM, you can avoid swimming in the warm freshwater bodies, lakes, hot springs, and poorly maintained swimming pools. And we have discussed earlier that the specific route through which this amoeba enters into your body is the nasal route. So you can use nose clips, or you can keep your head above the water during any kind of water activity. So it would prevent yourself from getting this infection. Moreover, proper maintenance of swimming pools is very important. Chlorination is important, as we know that chlorination, if chlorine is used in proper amount, it can kill most of the germs. So the proper chlorination of the swimming pools is very, very important. The treatment, if we are just discuss about the treatment, it is based on the use of amphotericin B. But it's not always that it is used alone. It is used with at least one of the other drug, and that can be any kind of like antibiotics such as erythromycin, dexamethasone, rifampin, or any other drug. So this was all about Naegleria fowleri or brain-eating amoeba. So if you have got any kind of queries related to this, you can write in the comments section. We will answer you there. And if you like the video, do like it and do share this video. And don't forget to subscribe to our YouTube channel. So until the next video, stay blessed and bye-bye.